And welcome back to Jeff Kananga live here at Citizen Television on the very last JKL of 2024. We've got the governor of county number 047, Sakaja Johnson, in the house, answering all the tough questions. What is he doing about the city? A lot of people say he's been a big disappointment. He says give him time. That's what you're saying, right?
No, I'm saying that the jury's out.
Jury's out, okay.
Those who are very happy. And there's what needs to be done, you know, I mean...
And you agree, I mean, you admit?
Of course, I admit there are challenges. And that's why I took the job. It's not an easy job. But I took it because there are those challenges. And they must be dealt with. There must be leadership. And as a leader, you must, you know, take stock of, yes, this is where we are with this issue. This is where we are with the roads. You know, the other day when it was flooding, I went to Ojijo Road. And the issue there is that, look, there's one drainage at 1200 and the other one is at 600 from Ojijo Road to Kipande Road. And I just had to call the guys, you know, can I come, knock this off? And there's a solution that, you know, is being provided. I went to Red Ginger and Second Parklands, Masari. Go look at it now. It's done. You know, I've sorted that out.
That was a mess, by the way.
Yeah, it was. And it's now proper. It's been sorted. We've done a new drainage on Masari Lane. We've done, you know, AC laying. At Brookside, you know, the kind of water coming in. The houses are on the river. You know, and you see the kind of amount of rain we get, you know, at a go, overwhelms the drainage system. We need to overhaul all of it. It needs money. Yeah, you need to be able to, I mean, if you cost it for an event that happens twice, thrice a year, yeah, it's a lot, it's in billions. But you also need to pay doctors. You also need to, you know, pay your teachers. You need to clean the city. And so it's a balance of what needs to be done, what's urgent, what do you have resources for, how do you increase resources. And that's why I'm happy. This year, you know, was a milestone year, raising the highest amount. And we raised more than what you're talking about in MS. They did 8.5. The first year did 10.5. This year we've done 12.8 billion, which could have hit 13 billion. It's just that the last week of the financial year, you remember what was happening in June with all the protests. And we hope to get to 20 billion this year and to unlock. And it's not money that we just think is coming from the air. We know what we're doing. We launched Unified Business Permit in January this year. For the first time, you have one license from Nairobi County. There used to be 6, 7 licenses. They all go to this office or go to this other office, go to this other office. Now it is one license, which you can do from the comfort of your home. We've fully digitized all revenue collection streams. There's no cash policy. We even don't have a cash office in the county anymore. Everything must be done online, and you can verify yourself. And so the next step that we're going into from January, and I hope to launch it on the 1st or on the 2nd, is Jitambulishe. So that every staff member of Nairobi County Government, if they come to your... First of all, it's one inspection team that we're going to publish the names of who comes to Westlands, who comes to Dagoretti North. Because there are many imposters harassing business people in the city. And we want business people to focus on their business. And so you'll be able to see, your name is Jeff, show me your ID. Everyone must have a badge. And you check it online, and it brings up your photo. And, yes, this is a certified staff member of Nairobi County Government, and they've come to look at this and that. So I mean, there are many things. The people whose lives have been saved in our hospitals. Nairobi had no ICU facility when I became governor. None.
What do you mean?
There was no public ICU by the county. It was Kenyatta, which is a referral hospital.
Right.
Right now, we've done a neonatal ICU in Magathi. We have a pediatric ICU. We have one also in Mama Lucy. We have a full ICU in Mama Lucy. We have in Pumwani. We have an orthopedic, section there that had never been there. We have the first public eye hospital in Kenya. The first public eye hospital in Umoja, where even the spectacles are being done there. In Umoja, there's a story of a man I met, and I really, it touched my heart. This gentleman was, I think, 91, 92 years old. He'd not seen for 50 years. 50 years. Because every time he'd go to get checked, he'd told 80,000, 100,000. He couldn't afford that. And so he regained his sight at Umoja 2. And so he's telling his son, I'm not leaving this place, because I think if I leave, the sight might go. And it's like, oh, you look like this. I thought you were more handsome. And he's joking about it, but you can see tears of joy. Wow. Those people's lives have been transformed. They will not say that there's been a disappointment, A friend of mine, his grandma's life was saved at that first ICU facility. We're doing dialysis. If you drive through Parklands, you'll see our cancer diagnostic center that we're now completing to equip, that we've put it together. We've hired more than 50 dentists. In history of Nairobi, dental services was seen as a luxury. Now you have dentists in every sub-county, taking care of our teeth.
And it's affordable.
It's affordable.
But
it's affordable.
But people are complaining that SHA, whatever it's called, it doesn't work.
The Social Health Authority and the Social Health Insurance Fund is a game changer.
Come on, man.
I'm a provider of medical services. I have more than 124 facilities. And I'll tell you, see, it was not equitable, Jeff. Someone like you, with your salary, paying a similar amount to a mamamboga for insurance. And I know a lot of people have taken a hit in their payslip, 20,000, 30,000. But we must take care of everybody. And so if you look at the benefit package under the social health insurance, universal health care is going to be achieved, And so you pay a percentage, the same percentage that person is paying, The means testing, as it's being improved, will be able to know, okay, this person should pay 300 shillings. For everyone who's registered, Jeff, for me as a provider of these services, if you register to a facility, for everyone registered, I get first 900 shillings, whether or not you come to hospital. So it covers for everybody, and I think we need to give it the time. We need to register on your phone. There's a USSD code that people are registering on, and give it a try, because the previous system was terrible. Nairobi is owed 800 million shillings by NHIF, 800 million shillings that could be in my facilities. They were paying mostly private facilities, and there was business ukora inside there. Right. But now that has been streamlined, And
but people say it hasn't kicked in, or then they're getting rejected, especially dialysis patients or patients who are going in every week.
Every fund has a maturity period, first of all, but also it takes, there's been a teething issue over there, and it's something we raised as governors. Yeah. Look, this thing needs to work. But we have messages of people who have, surgeries of 300,000 approved, 400,000 approved, and it's working for most people. And so healthcare must be seen as a service and a public good that everybody deserves. No one deserves to die because of a disease that could have been treated. Look at the community health promoters. I have 7,820 of them in Nairobi. And it's something we pushed. When I was senator, I pushed for them to get stipends. They're not getting it. We were the first to start paying them 3,500. The national government has now added 2,500 shillings on top of that. And they're covering 784,000 households in the city for issues that will not need you to go clog the system in our hospitals. So what I did is I changed the governance structure of our hospitals, because previously, hospitals were being led by a medical superintendent who's a doctor, And there are more elements of a hospital than just medical services. There's a human resource issues. There's the, health management information system. There is supply chain. So I got CEOs. Yeah. If you look at what the CEOs have done in our level 5s, and I changed all those boards, it's transformative. If you look at the new A&E center, Mother and Child Center, now we're signing with Kemri for Mbagathi to be a research hospital, the first public research hospital in this country. So now at the level 4 hospitals, I'm also introducing CEOs. And so it is working. I know the pace people want to see immediate transformation. We're a generation that wants things now. Unfortunately, things do take some time. And people are seeing those fruits.
Speaking of taking some time, the feeding program.
Yeah.
That one has definitely worked. If there's anything, if a credit can be given.
Jeff, have you gone to St. George's here?
Down the road,
on the street. Just go.
Yes.
Any public school, go at lunchtime. So you know what happened, and let me just give also a brief background to that. When I was a senator for Nairobi, during COVID, remember, schools were closed for a long time.
Yeah.
And during the closure, there was a lot of vandalism of desks, of, in the schools. People were taking them to sell scrap metal. Yeah. And so a group of friends and I came together, got some donations of desks. Tetra Pak also helped us, and other donors. And so I went to a few schools donating desks. And in every school I'd go to, normally you'd go and say, oh, I brought this. They're like, hey, super senator, and they get excited. And you ask them, what would you like? And they'd say, we want footballs or sweets, or, But the kids started saying, we want food. We want food. I went to Kenyanjuru Primary School. We want food. I got them 2 bags of, a few bags of maize, but it wasn't sustainable. And the look in the kids' eyes, here in Kawangware, I was like, I can't disappoint these kids. And so I brought a motion in the Senate about school feeding, when the senator for Kitui had brought something on beans. I had researched in the US that the National School Lunch Act of, I think, 1945 or 46. And I promised that when I become governor, if Nairobians would elect me, I would do that. Many people thought it's impossible, that it's not sustainable, you cannot do it, you can't afford it, the kids are too many. And I said, I'll do it. And so we broke ground. We've built 17 mega kitchens. Each kitchen does 15,000 meals, thereabout.
A day?
A day, 15,000, We got a partner called Food for Education, who we procured them to run the service. Of course, it's our kitchens, we pay for the subsidy, and they're doing an amazing job, and they've already built a giga kitchen in the Russell area that does 60,000 meals, one kitchen. Today, Jeff, we're feeding 300,000 children. There used to be 210,000 in our schools. Now there are 316,000 children. Enrollment has gone up. Those kitchens are seen as almost like temples. In every sub-county you go to, you'll see it. It's a beautiful, and I did not go cheap on the quality of the kitchens. The floor, the stainless steel, the surfaces, the cooking, the sufurias and all that. And so, January this year, I was issuing support to children, scholarships and bursaries in Nairobi Milimani here. A young girl comes on stage. She's gone to, she's been admitted to Form 1, and she's getting her scholarship for 4 years. She's wearing this watch. This is a tap to eat, the technology we use to feed our children. Yeah. It's an NFC device. From this, I can tell how many children have come to school, how many have eaten, whether we have permission, any allergies, etc. So she's still wearing it. Her name is Mildred, from New Kiumbuini in Kangemi. And I ask her, so why are you wearing this watch? And she gives me her story. She's an orphan, living with her grandma. She would go to school only twice or thrice a week. So she was performing badly. That last term of her final year is when we had introduced the program. That time we were feeding 88,000 children. She went to school every single day. Because of that, not only did she perform, she was one of the top performers in Nairobi, got admitted to Loreto Convent, Limuru. And she said she'll never remove this watch because it has changed her life.
Wow.
Will those people say they're disappointed? Jeff, with the same grit and the same vision and the same energy, I've sorted out school feeding and the future of our children. Is what I'll do with our roads. Is what I'll do with the environment. Is what I'll do because it's that level of focus. I sat with contractors. I've never met contractors before they get work. I sat with them and I told them, you're not just building a kitchen. You're securing the future of our country. If you see these kids after school, skipping, hopping around with their lunch boxes, they don't finish the food. They keep some for home.
For later.
For later or for siblings.
Oh.
These children feel loved. They are getting healthier. But they feel, look, there's a government that actually cares about me. What about the parent? A hustler who works at Mjengo, who's not sure whether or not he'll get a gig today. They go and they see the ladies here at Olodume Road. They don't know Mama Fua whether she'll be called to work. But deep down she knows, no matter what, my child is getting fed. At 5 shillings. Jeff, what can 5 shillings buy you? It's a full 650-gram meal. There are farmers from across the country. We get these mung beans from Kitui, from Ukambani. We get tomatoes from Nakuru. We get beans from Nyeri and from all over the place. Our rice, etc. More than 2,000 jobs created. There's a lady who told us a story. She'd been in Nairobi. She's at Babadogo. She works in the kitchen. She'd been in Nairobi for 6 years from Bungoma. Never got a job. When her children saw me in school saying, I'm going to build a kitchen and I'll feed you, they ran home and said, Mom, Governor amesema kuna kazi. She worked in that mjengo. She built the kitchen. She now cleans and serves in that kitchen. If you see her, when she's not wearing those aprons, etc., you not think she's, someone who would require that intervention. It's given them dignity. And the community loves it. There's a driver who gave a story, because it's central kitchens. So one kitchen, it's hub and spoke. So the kitchen is the hub. And then it serves many schools around it. This driver was saying that at lunchtime, or towards lunchtime when he's driving to the schools in Kibra to deliver the food, matatus move out of the way, say, Peter, peleka chakula kwa watoto.
No.
Take the food.
In Kibra.
When did Kenyans do that, Jeff? When did Kenyans do that?
Never.
It's created such a sense of community and hope. And let me tell you, the same alacrity with which I worked on that program is the same way we'll fix this city.
So why,
it must be fixed.
Yeah, so why do they say this county is so corrupt?
Well, you see, because it's a story that's been told for a long time. You know, if the county was corrupt, because the biggest leakage, if you want to steal, the biggest leakage is by having cash, you know, human interaction with cash.
Yeah.
Not having, you know, your revenue coming in through a system where once you pay on your phone, *647# on nairobiservices.go.ke, automatically it goes to our bank. And that account is audited, those accounts, Equity and Cooperative Bank, automatically flushed into the county revenue fund, you know. And so once you've closed those loopholes, that's why we've raised the highest revenue, you know. Previous administrations had everything. You know, NMS had the police, even bombs and guns, but they couldn't go beyond 9 billion. Why? Because there was leakage. So more than 140 revenue streams, 141 to be exact, have been digitized, you know. And so that is why people are asking, where was this money? How comes the road is being done here? The children are being fed. How have we been able to hire 3,500 young people to Green Army, 1,500 constables, more than 100 doctors, 1,500 health workers? How are you paying these salaries? My wage bill is big, yes, but it's a service county, you know. And as we increase our revenue, this year we're coming to do regularization of unauthorized, you know, developments. We're the only county with an up-to-date rates, you know, up-to-date land rates, 2019. We used to be in the 1980s valuation roll. And it's a conversation I must have with Nairobians, because we have around 200,000 parcels, but only 50,000 accounts are paying land rates. Everyone must pay their share.
Yeah.
Because you want that road done, but you don't want to pay rates. No. Let's have a discussion about the service. And people are willing to pay once they're assured of a service coming to them. And so it's chicken and egg. Like, okay, also to give you the service, I need the resources. Yeah. We're the only country that does property taxes on an improved site value. It's unfair. That, I'll give you an example. One house in Kileleshwa, for instance, on half an acre, will pay the same as the neighbor with 60 apartments. They all need water. Is it fair? It's not equitable. The same piece of land in Runda will pay rates like Githogoro next door. Githogoro is a mabati house. This one has a mansion. So we must look at changing that. And that's a conversation I'm willing to have with the people of Nairobi. Speaking
of apartments.
Yeah.
Some of these apartments that we see that have literally come up, you said 16, 15, 20-story apartments.
Yeah.
They say it's wash. It's all drug money, well, because half of them are empty.
You see, if somebody decides to invest in that apartment, it's not for me to know where the source of money comes from. You know, there are agencies. We have anti-money laundering. We have the ESCC. We have DCI. For us, is have you abided by the rules? And many had not been abiding by those rules. You know, we commissioned an audit of all developments in the last 2 years. It's been done by the professionals, by the Architectural Association. They're there, the engineers, etc., looking at, you know, all of these developments. And what we've said is, look, some of these roads you're complaining about that have been destroyed by these huge, you know, pre-mixed cement trucks. Yeah. That our finance law had no way of charging them. We're going to charge them. And we will not give you an occupational certificate if you have not restored that pavement, that road, to how it was as you bring your, you know, so we don't want to push away investment into the city. There's a reason why people want to build in the city, but there must be green spaces. There must be adherence to the rules. And for many of them, they're willing to do it. You know, normally a small percentage spoil the name of very many of these developers. Yeah. You know, we have Kenyan private developers. You know, we have some from China. They're quite a number. But they're investing in this country. If you look at the number of people working at those sites, you know, at those mijengo, it's our brothers and sisters who need work to do. And so if someone has chosen to invest and they have figured out what their market is, and then their house becomes empty, then it's up to them. But we want it to be done in a proper manner.
Yeah.
And so we continue to enforce on those developments. There's a time I even issued a moratorium on new approvals until they all came in through the system properly. It used to take so long, to actually go through the process. Now the committee sits every fortnight. I told them whether you have 2 applications or 2,000, you must sit every fortnight to go through them. The mandate is normally just for the county.
Right.
But we created an urban planning technical committee that has the private sector, within that committee. So you have the engineers, you have Warma, you have Nairobi Water, you have the military because of some of the protected installations, and that is what is happening. Now, many people have said, look, why are we going up? We should not go up. There's something called urban sprawl or urban decay. When you spread out development too wide in terms of housing, and people do not have the amenities, so you have to wake up at 4 a.m. to take your kid to school across the city. One of the greenest parts of the city, of the state, if you Google, and it will surprise you. The greenest city in the U.S.
Go on.
Manhattan.
You're kidding me.
Yes.
You're kidding me.
If you look at the heat map, it's a one green spot.
Because of Central Park, or
because of the fact that people are walking to work. You don't have long distances, the emissions, and so you need to densify parts of your city, but make sure you provide the water infrastructure, you provide the sewer infrastructure, which are things we are working on. With the Rivers Commission work that we're doing, which we constituted jointly with the national government, we're doing huge trunk sewers, along the river, for instance, 54 kilometers. And we're doing a 1,200 one, which will last us another 40 years. The financing has been found for it. Yeah, and that work is exceptional. There's 20,000 young people working, cleaning our river every day.
We've been trying to clean Nairobi River for how long?
Because we were doing cleanups. We were not doing a proper restoration of the city. A cleanup, a cleaning today, then tomorrow. The biggest pollution into the river is the sewers, because the sewers are not being provided. So many people had connections. And that's why we said, let's do a trunk sewer on both sides, Nairobi River, then move to Mathare River, move to Ngong River. And what people don't realize, it speaks to the heritage of Nairobi. Nairobi is a Maasai word for the rivers, a place of cool waters.
Cool waters, yeah.
If you look at the 1928 master plan of Nairobi, the colonialists wanted a buffer between them and people who look like me and you, And so you see what they call a green buffer zone that they created. They took the high areas, the Muthaigas, the Hurlinghams, even Karen, which is the highest point in the city, etc., and had Asians, and then that is why when it flooded, which places were affected? The slums.
Areas, yeah.
Even now, it was Mathare, it was Kibera, it was Mukuru, etc. So the city inverted and hid its rivers. Most cities across the world, the river is the frontage. The river is where you want to go have an alfresco lunch. It is the best real estate. But Nairobi, because of the river being dirty, everyone has run away from it. Let me tell you, the intervention by our president, the intervention by the county government, will completely transform.
How long? When do we have to wait? I mean, come on, man.
This first program is 24 months, Jeff. 24 months. The contractor has been identified. The work has started. Climate works. Just walk. In fact, there's normally a heap over here as you come down Cotton Road.
Yeah.
It is from the river. That heap is from the river, And so waiting for the truck, because also, it must dry. If you carry the trash when it's still wet, it's too heavy.
Correct.
On the truck. The president has really committed to support the city.
Okay, I want to take a break, come back, talk more about... You're in UDA.
Yes.
Last weekend you were in Addis Ababa.
Yes.
Supporting Baba for his bid to the Africa Union Commission chairmanship.
The incoming chair, inshallah.
Which party are you in? I mean, what's going on?
I'm in UDA. I'm the leader of UDA in Nairobi.
But then you're supporting Azimio.
I'm supporting a Kenyan who is going for a seat that is continental, that we should be proud of, and who deserves that seat. I'm supporting Raila Amolo Odinga. And of course, I work with him also politically in the city. We're in broad-based now, and so it's easy. It's good. Things are, and our politics must never be defined by who you can't work with. No.
Is he going to win?
He's going to win.
If he doesn't?
He's going to win.
If he doesn't?
He's going to win. Baba is going to win. Did you see the debate?
I saw it.
There was a difference between a statesman,
yes,
a leader, and managers. And I told him, please, if you win, when you win, hire this other guy to be your CEO or SG.
The Djibouti guy.
Yeah, because he looks like also he has passion.
Yes.
But the statesmanship you require
Right.
to, handle presidents is at that level.
Yeah.
That level is where Baba has reached.
Yeah.
He did exceptionally well.
By the way, that debate was on Citizen TV. You know that, huh?
Yes, I was with Leto in Addis.
Oh.
Yes, he was there.
Nice.
You missed out.
I missed out, huh?
Yeah, you missed out.
Damn.
Yeah.
And Seth Olala was also there.
I didn't see Seth. No, yes, I did. Actually, when we got out of the debate, Seth was there.
Yes.
Yeah, Seth.
We're going to take a break, come back. Governor, the magic wall. Lots of questions, lots of comments. We'll come back. The governor has no fear. None whatsoever.
No fearful bone in my body.
In answering your questions and comments. So keep them coming. At Koinange Jeff, at Citizen TV Kanga, hashtag JKLIVE. JKLIVE.